an opportunity to serve at the pleasure of Delaware's Lyme Disease Education Oversight Board as the chair. This board is an example of what happens when a state creates laws with a One Health approach to a statewide problem, which is tick-borne disease, and people from diverse backgrounds who are open-mindedly collaborate for the greater good to educate all state healthcare providers. So first, gratitude. First of all, to the Partnership for One Health Delaware, Dr. Doug Riley, Kathy Jo Robbins, Jillian Austin, thank you so much. This board is only possible because of incredible collaboration statewide. I'd also like to thank the Division of Public Health, our colleagues who have been absolutely pivotal in supporting the board. That includes Kathy Jo, Jill Austin, and Shelley Stewart. Thank you, guys. Also, our colleagues at Public Health who come to our board meetings, including Tony Alvarado and Jamie Cananan and Abigail Haycroft and Susanna Bowman. Thank you all. So it is because of relationships and collaboration and working together with people with very diverse opinions that this board actually works. And I would like to, before I move on, just acknowledge and thank every member of this board. Also, thanks to UAD for this gorgeous venue. It's incredible. First of all, Dr. Becky Benson, the former board chair, and without whom this board would not be in existence. Dr. Ashley Kennedy, you just heard her speak. I call her the tick guru. She's amazing. Dr. Jeff Cheskin, Dr. Jennifer Horney, Dr. Lori Maramonte, the vice chair, and really the brains behind me. I couldn't do this without her. Naturopath Debbie McCabe, Dr. Mike Metzler, veterinarian, Dr. Neil Relosa, ID doctor, Dr. Doug Riley, and Miss Carrie Santos. So the history, how did we get to here? Well, 10 years ago, there was the Lyme Disease Prevention Task Force, which I was honored to sit upon. In 2014, Delaware state legislators formed this bipartisan task force due to the high incidence of Lyme disease in the state and potential for long-term illness for Delawareans. The task force consisted of legislators, healthcare professionals, community members, and Lyme disease patients, and they created a final report. And in this final report, there were 7 recommendations. Those 7 recommendations were to prevent, raise awareness, improve treatment, improve insurance coverage for Lyme and other tick-borne diseases. Out of these 7 recommendations, so far, we have 2 recommendations that have been implemented by several state laws. That is DENREC's tick program, as you heard about already today, and the board that I'm speaking about. Delaware Lyme law history. So we are the only board that I know of that exists in the United States. And it is because of state laws and collaboration across the state that our board exists. I'm going to go quickly through these slides, but to date, we have 19 laws and resolutions in Delaware. I believe more than any other state on the East Coast, and potentially only more laws and resolutions in the state of California. We are literally a leader in this space. So thank you to everyone in this room for that. That's part of that, because many of you are. So the summary of these is that we have resolutions on Lyme disease awareness. We have several bills that are for our board, as well as clarifying the function of the board. And also, we had another bill in the state that it required that every healthcare provider, every person that received a Lyme disease test in the state received a piece of paper talking about the limitations of testing. So this is just to show you that things are really happening here for Lyme. So what is the board's mission? The board's mission reflects a paradigm shift. We have a mandated mission by the state laws for our board. We have to, by law, educate Delaware medical providers, and I believe there are over 52,000 licensees in the state. We have a big duty here. And they're to be educated on Lyme and tick-borne diseases with, quote, and this is a quote directly from the law. Can you all hear me okay? This is a quote directly from the law, with quality and balanced medical education by including philosophies of CDC, guidelines established by International Lyme and Associated Diseases Society, and the latest scientific evidence and research. Our board has 11 appointed members that are appointed by the Delaware's governor, the president pro tem, the speaker of the House, and the director appointee of the Delaware Division of Public Health. Our board philosophy, we adhere to a One Health paradigm, and we do this because it is actually the way the law is written. I meant to say that if you'd like to see the links to all of the specific laws in the state of Delaware, you can go to the board's website, LymeDiseaseEducation.org, and you'll be linked right to the state website. So you can look, you can read all the laws if you're so inclined. Might take you a little bit of time though. So our board has formally adopted this approach, the One Health approach. And we believe, live by, and adhere to operating with respectful collegial dialogue that welcomes and appreciates and actually honors, truly honors diverse opinions. We believe, our board believes and lives by the fact that we have a duty to listen to all perspectives. Every single perspective that comes to our board needs to be listened to, and with an open mind and willing to change course given new research. We operate with integrity because we serve the public good. We have a duty to all the providers in the state who have a duty to every single Delawarean, and our board takes that privilege and opportunity and responsibility very seriously. We are a funnel of information. We don't decide it, we just funnel it through to providers. The board also has a strategic plan, thanks again to Dr. Lori Maramonte, which is based on the law. Lori took the law, which has been, formally adopted, by our board, by board vote. But the law, we have a strategic plan based on our law. Our board believes and lives by what I call what I think is the One Health philosophy, which is teamwork makes the dream work. The board's heard me say that so many times. It's the truth. Our board also has a physician review group, and this physician review group reviews information on healthcare provider educational materials. We take our duty and our responsibility to every single provider in the state as an absolute important privilege. The key accomplishments of this board include, we developed and offered a free online CMA called Clinical Guide to Diagnosing and Treating Lyme and Other Tick-Borne Diseases. We did this in a collaboration with Global Lyme Alliance, and also it was presented by UCSF researcher Dr. Charles Chu, along with neurologist Dr. Elena Frid. This was a CME that was on MedPages, and it also was vetted by a third-party company that vetted it for medical and scientific integrity. We launched our website, LymeDiseaseEducation.org, last year. Woohoo! Thanks to many people. And we held Lymeware Delaware Conference on May 17th of this year. Thanks to many people in this room. Here's our website. What happened at this healthcare provider conference? Many amazing things. So on May 17th, for a full day, we had this conference. It was held in collaboration with BB Healthcare. As many of you know, it's the second largest healthcare organization in the state. They were wonderful to work with. It was in person at the Lewis Public Library, and it was also online. I am just in awe and honored to say that there were nearly 400 registrations by Delaware healthcare providers, and over 200 people, healthcare providers, attended, and they were offered up to 6 free CMEs. Who was there and what did they talk about? The guests that we were honored to have join us were Speaker Pro Tem, who was Speaker of the House for 13 years and has been a representative in the Lewis area for 22 years. Representative Peter Schwarzkopf talked about Lyme law history. Dr. David Tam, the president and CEO, opened the conference, and we also had remarks by the Insurance Commissioner Trinidad Navarro, who has efforts through a personal story with Lyme disease. The Delaware specific research was from Deltec, Dr. Michael Boney, who talked about his multiplex assay for surveillance of Delaware tick-borne pathogens, and the fine Dr. Ashley Kennedy, also on the board. We also had tick-borne disease research discussed. Dr. Chukri Ben Mamoon runs Yale's lab that does Babesia and translational medicine. He is internationally known in the Babesia space, and his work has been featured on the cover of Journal of Infectious Diseases. We had Dr. Monica Embers from Tulane talk about antibiotic efficacy, as well as Dr. John Alcott from Johns Hopkins, who runs the research center at Johns Hopkins. Dr. Alcott spoke about the rashes, different presentations of rashes. Dr. Brian Fallon, who runs Columbia's research center, he spoke about neuropsychiatric manifestations of Lyme. Dr. Elizabeth Maloney, who was on the Federal Tick-Borne Disease Working Group, spoke about treatment as well as testing. And Dr. Neil Relosa, infectious disease doctor from Nemours Children's Hospital, also spoke with Dr. Betty Maloney about treatment. What was some of the feedback we received? The feedback was overwhelmingly positive on this conference. It included things like extremely informative and interesting, received excellent website resources and contact information from experts in the field. As a nurse, I'm going to use my platform to speak to people and explain the prevalence. The feedback we also got from presenters, by the way, unsolicited, was things like from Dr. Brian Fallon, Columbia's director of their Lyme and tick-borne diseases research center. The Delaware meeting was a great success. I was so impressed you were able to pull this off. It's rare to have a Lyme conference that so many healthcare clinicians attend, and one that both influential political and insurance leaders attended. I especially appreciated the dialogue at the end between the doctors from the two organizations, ILADS and IDSA. It was so respectful, clinically relevant, and comfortable. I've never seen such a dialogue before. The dialogue certainly allowed listeners to hear how the two guidelines are similar but also differ. Dr. John Alcott, who is from Johns Hopkins School of Medicine, the director of Lyme Disease Clinical Research Center there, Dr. Alcott also was the chair of the Federal Tick-Borne Disease Working Group. We had really an incredible slate of speakers. Dr. Alcott said the Delaware meeting was a great success. I was so impressed you were able to pull this off. What an incredible educational event. This will go down as the gold standard for statewide Lyme and tick-borne disease education with an incredible outreach, a truly amazing accomplishment. This was unsolicited feedback that were received by great minds in research. Ashley already covered this, and so did many other people. Thank you all so much. It is because teamwork truly makes the dream work. from public health and legislators and people across the state. This board is doing amazing things to help our providers with the One Health approach. Thank you all so much for your attention. And if you want to hear more, check us out at LymeDiseaseEducation.org, where there is free CMEs. Thanks so much.